You're watching CTOM TV. Knowledge is power.
Okay, so we were talking about the 4 pillars of precision oncology, the first being enhanced diagnostics like PET-CT, genetic testing, the second being personalized research, making sure everything is as thorough and accurate and as simplified as possible. The third, we've just run through, not an exhaustive list by any means, but kind of Alex's kind of top of mind options for treatment that are somewhat dependent on some of those precision diagnostics in order for you to know which one of those treatments is going to suit you best. Now we're talking about, okay, if I've gone to all this trouble of doing all this extra stuff to make sure I'm on the right treatment, how do I make sure my treatment is working as well as it should? And this is the 4th pillar of precision oncology, which is accurate treatment monitoring. PET-CT we've already talked about is one way of following. In the way that in standard care they use CT scan, which we've talked about, is 60-ish% accurate, but requires numerous scans for that 60% and only shows shapes and shadows. It doesn't tell you the biological activity and whether something is alive or dead, cancerous or not. So PET-CT, if your doctor is recommending CT scan, maybe see if they'll give you a PET-CT, and if not, there are numerous private clinics where you can get one. But in addition to that, I wanted to give you a chance, Alex, to talk about liquid biopsy for treatment monitoring.
Yeah, so liquid biopsy is a relatively new tool. We have developed something called a exosome-based liquid biopsy. So exosomes are little packets of DNA and RNA and proteins that are released by tumor cells in order to create a metastatic environment elsewhere. So it's a metastatic process. And they release these mutations or this mutated DNA, and the mutated DNA can also get taken up by other cells and converted into tumor cells. So what liquid biopsy is, what an exosome-based liquid biopsy is that we take a mutation that we know is a driving mutation in your cancer, such as an early event mutation, in other words, a KRAS mutation or a BRAF mutation, that we know is something that happens in normal cells in order to transform into tumor cells. And we track that mutation in your blood as a relative marker for the amount of tumor cells or the amount of cancer that you have. So this is important because, as you know, the standard treatment protocol for determining whether treatment is working for you or not is to measure the size of the tumors and to go back 4 months later. Well, you don't want to have to do that. You don't want to stay on a drug that's not working for 4 months, because by the time you find out it's not working, it's too late and it's spread all over the body. And then number 2, if you're paying for that drug out of pocket, you could have spent, a lot of money. Some of these drugs are $10,000, $20,000 a month. So you don't want to do that. And you want to know if your treatment is working right away. So the best way to do that is by looking at the amount of tumor DNA that is the specific mutations to your cancer. And so that's what these liquid biopsies do. So let's say you're about to start this treatment and you're not sure if it's going to work. You're paying for the drug and you want to make sure it's working before you do months and months of it. What you do is you do this liquid biopsy. And let's say we're monitoring your KRAS mutation. And prior to treatment, your KRAS mutation is 8%. Then you do your treatment 10 days later, we check you again, and it's down to 2%. And we know your treatment's working. However, if the treatment or if the treatment's not working, then that percentage will stay at 8% or it will go up. And then we know the treatment's not working and we need to try something else. So this is a really good tool for trying a bunch of different treatments and finding out what's going to work and what's not working. It's also good if you're in remission and you want to make sure that your tumor is not coming back. And so we've found that we can detect when a tumor comes back months before it's big enough to be seen on a scan using this technique. It's a great tool and it's really changed how we treat cancers. So liquid biopsies monitoring is a great complement to standard therapy. More importantly, if you're getting immune therapy, there's a certain percentage of patients, about 30%, 25 to 30% of patients that get immune therapy get something called pseudo progression. That means fake progression. And basically what that means is that the immune cells will enter into the tumor and they'll start rapidly reproducing inside of the tumor. And what they'll do is they'll make the tumor look much bigger than it normally is. So immediately you'll see, these tumors looking bigger, but really it's the immune system killing the tumor from the inside out. And so it's a positive thing, but on a scan, it looks like a negative thing. And so, in the beginning of immune therapy, many doctors would take patients off treatment when those treatments are actually working. And then years later, the patients would come back and they would say, oh, I'm still alive. And the doctors would be, what? How your tumors were growing? How can you still be alive? So now we know that, patients have this problem. The issue is there's no way of determining if you're in pseudo progression or not. They can't determine that except for waiting it out. There is one way, you'd think, that would be PET-CT. But with PET-CT, the immune cells also drink up the PET fluid. And so when you do a PET-CT of a tumor that's being attacked by the immune system, then it's going to look like it's hot. It's going to have a high SUV, just like a growing tumor will. So it's really hard to tell the difference between a tumor that's being attacked by the immune system and a tumor that's being attacked or that's growing. So the liquid biopsy solves that problem. It allows you to see the actual percentage of the tumor DNA, which is going to change. So if the immune system is attacking a tumor from the inside out, then you're going to have a lot less of that tumor spreading its tumor DNA out through exosomes. And so you'll see that. So there's been cases where we've had patients where the doctors wanted to take them off the treatment. We've tested them for their KRAS or their, whatever mutation. And we've seen that the mutation was down to 0. And so we got back to the doctors and said, well, it looks like that patient's tumors are growing, but the reality is they're not, because they have a very low percentage of their tumor mutation in their blood. So it's a great tool for that purpose too. So it's a good complementary tool.
Thank you for watching CTOM TV. Subscribe below and stay informed.